look at the country's most pressing issues. So here to give us an update on the COVID-19 national situation is Dr. Althea de Guzman from the DOH Epidemiology Bureau. Althea.
Thank you, Chola. And again, good morning to everyone. This will be a fairly short deck. We'd like to update you. Kamusta na po tayo ulit nitong nakaraang linggo. And I'd like to start off with this, no? So last week, we've already mentioned that we have seen an initial rise in our cases nationally. And for this week, that decline has actually really stalled, no? So bumabagal na talaga, nagpa-plateau na po tayo. And in the recent 7 days, we're seeing increases, no, in our cases nationally. And the increases are contributed to by these three things. Una po, ang ating NCR plus ay bumababa, ang NCR area bumababa pero napakabagal na ng pagbaba ng kaso. Nakita natin sa plus areas, inconsistent po kasi yung pattern niya. There will be times when it's going up and then it will be going down, no? So hindi siya steady decline as we're seeing in NCR. The third is, though we're seeing some improvements in the Luzon and Mindanao areas, it hasn't significantly gone down. No? It's almost a plateau, as I will show you later, no, after that initial rise over May. And then the third is, while Visayas doesn't have the same number of cases as Mindanao or the rest of Luzon, nakikita natin over the last week, siya yung may mabilis, no, na pagdami ng kaso among all the island groups. The second is that itong tuloy-tuloy na pagbaba at ito namang nakikita nating pagbaba, no, sa kaso, lalo na sa NCR+, ay tinatawag naming fragile. Ibig sabihin, magkaroon tayo ng mga super spreading events. It's possible po talaga na dadami na naman, no, magkakaroon tayo tinatawag nating spikes in our cases. And that's why we're saying the trends can go either way. It can go up again or it can really go down continuously. And that will really depend on, number one, how well we are implementing our PDITR strategies. And second is always, no, the core is MPHS protocol adherence. And then the third, as we're seeing increases in Visayas and Mindanao, and while they are fairly small areas, we see na ang kanilang healthcare capacity, yung fragile din. So kailangan, habang hindi pa overwhelmed ang ilang areas natin sa Visayas and Mindanao, natuto na tayo from NCR+, na ngayon pa lang dapat ino-augment na natin ang ating critical care capacities. Critical care ICU beds, which our secretary is calling, these are our life-saving beds. So yesterday, these are the numbers we reported. What I'd like to focus on is in our top regions, we're seeing that hindi na nga top ngayon si NCR. It's actually Calabarzon, no? For the past few days na nagko-contribute dun sa highest number of cases per region. And we're also seeing Visayas and Mindanao regions such as Region 6 and Region 11 nakasama dun. And on a more granular level, these bigger regions are now contributing, no, to the daily cases po natin. This is our latest table showing our 2-week growth rate and our ADAR. So una nating tingnan yung row ng Philippines kung saan nakapagtala tayo ng 15% increase in the reported cases in the last 2 weeks in comparison to what we are reporting or we have reported 3 to 4 weeks ago. Currently, tayo ay naka-moderate risk pa nationally. Kaya lang nakikita natin sa pagdami ng kaso, tumataas din ang ating ADAR at siya ngayon ay nasa 5.96, no? Yung tatlong rehiyon na na-classify natin based on their case data as high risk are regions 2, Caraga, and 6. Dati kasama po ang NCR, now it's back to moderate risk, no? So bakit naka-high risk to? Hindi lamang dahil ang kanilang ADAR ay naka-high risk, nakikita din natin sa column ng growth in cases na in the recent 1 to 2 weeks, they are showing increases in their newly reported cases. So, and all of these, so except for the two, these are we have one from Luzon, one from Mindanao, and another from Visayas. No? And also, we have other areas showing positive increases in their cases, and these are regions 11, 10, 12, 3, 8, 7, 1, 5, and 4. NCR has registered a 16% decline in the recent 2 weeks. Pero kung ikukumpara natin sa decline niya in the previous 3 to 4 weeks, which is at negative 40%, ito yung ibig namin sabihin na bumabagal na yung pagbaba ng kaso sa kanila. Ang kailangan din nating bantayan na as isang metric natin kung kinakailangan ba tayo mag-escalate ay ang mga regional healthcare utilization rate. Sa ngayon, wala naman tayong nakikita na naka-high risk or critical risk. Subalit, itong tatlong rehiyon na nakatag natin as high risk for their cases have a moderate risk healthcare utilization, and also Region 11 with a 63% regional healthcare utilization. But what we are also closely monitoring at makikita natin on the column to the right that the ICU rates are also going up. And these are the beds that we are closely monitoring and want to ensure na sapat talaga, because these are where our severe critical cases are being admitted to. And as we all know, they are the ones most at risk to become fatalities. Gusto rin namin mag-flag ng 36 priority areas. Kapag sinabi po namin, just to clarify, that these 36 priority areas were flagged because, una, ang kanilang risk classification or ang kanilang 2-week growth rate or di po kaya yung kanilang ADAR ay pula na or high risk na po. Sinasabayan pa na ang kanilang provincial healthcare utilization o di po kaya ang kanilang provincial ICU utilization ay naka-high risk na po or hindi kaya kapag itim po, ito ay critical risk. Sa ngayon, nakikita natin 20 of these 36 priority areas are coming from our Visayas and Mindanao regions. But this next table emphasizes na kahit mababa pa yung kaso natin, posibleng nagsisimula na napupuno ang ating mga ospital at ang ating ICU bed. So in these 6 areas, nakikita natin na pwedeng low risk pa yung classification nila. And in fact, they're showing less reported cases, but they already have high to critical risk, either a provincial aged care or a provincial ICU utilization. Ito po yung sinasabi ng departamento na napakahalaga na meron tayong sapat na kama. Kaunti man or bago pa po dumami ang kaso, bago pa tayo makakita ng spike, hinahanda na natin ang ating mga ospital para kung magkaroon nga po ng pag-spike, pag-increase ng kaso, hindi po ma-overwhelm ang ating mga ospital. Just to further quantify this increase that we're seeing nationally, for June 7 to 13, our average daily cases is at 6,699, around 100 cases higher than the average we reported in the week prior at 6,558. Of course, we have already significantly declined from the peak of 10,845. Pero hindi din sinasabi natin na we need to be even more vigilant kasi malayo pa tayo doon sa pre-surge levels natin, which is kung titingnan nyo dito, hindi pa tayo umaabot ng 2,000. And in fact, diba, on January to February, we were even reporting less than 1,000 cases per day. And if we look at the different island groups, the two lowest are the ones from the NCR plus areas. Now, represented here, the blue line is NCR and the green line is the plus area. So I'll show the more specific line graph later. Pero in terms of numbers, pataas na po kasi ang rest of Luzon, ang Mindanao, represented here by the orange line, and the blue line. So, siguro gusto ko lang namin i-context na ang mga island groups natin, for one reason or another, are all priority groups. Bakit? Number one, priority ang rest of Luzon, Visayas, and Mindanao because their cases are going up. But NCR Plus is also a priority because even though it has already declined significantly, we have seen not as much fast a decline in the recent month. At yun po yung sinasabi natin na if there are any super spreading events, if we are not going to be as effective in our MPHS and PDITR, that plateau can become another uptick or increase in cases. To also further quantify yung datos natin sa NCR Plus, nakikita naman natin na bumababa nga siya. So 833 average cases per day in the recent week, versus the 997 the week prior. Pero mapapansin talaga natin yung mabagal na pagbaba ng mga kaso natin. Kaya napakahalaga. Ito yung panahon na ang term nga natin, ito yung panahon na habang bumababa ang kaso or mas mababa na yung kaso, talagang suyuri na po. At hanapin natin itong 833, itong isang hindi pa hihigit sa 1,000 kaso kada araw na nakikita in the whole NCR. And looking at the 2-week growth rate and the ADAR of NCR, nakikita natin na bumababa naman. Subalit may mga iilang munisipyo na medyo tumataas na po ang kanilang ADAR. Hindi po napakataas, pero ito ay senyales na kailangang dagdagan ang ating paghahanap ng kaso, ang ating detection, ang ating testing, at i-review kung gaano ka-efficient ang contact tracing at isolation natin. Pero tayo ay natutuwa na from a high risk classification ng NCR, ngayon ay moderate risk na siya. At kung dati halos lahat to ay pula or even itim ang nakikita natin, dumadami na po or nababawasan na po yung mga pula o yung mga NCR areas natin na naka-place pa into high risk. Right now, Parañaque City at Pasay City po ang naka-high risk classification dahil padami ang kaso niya, at the same time naka-high risk pa po ang ADAR niya. Nakikita din natin sa huling column na meron tayong mga syudad naka-high to critical risk pa rin ang ICU rate. Subalit kung titingnan natin siya na per distrito, tayo naman po ay we don't refer to our own LGU, right? We also refer to LGUs outside, and that's where our healthcare provider network comes in. Makikita naman natin halos lahat po ay wala na po tayong high to critical risk. Subalit binabantayan natin ng 4th district dahil ang kanyang ICU rate ay naka-moderate risk, slightly above lang po at 61%. Pero in terms of their healthcare utilization, lahat po sila safe zone na with an overall NCR healthcare utilization of only 36%. Ngayon, tingnan natin ang plus areas. Bakit tayo higit na minomonitor itong mga plus areas? Kung makikita natin, ang plus areas natin, ang Rizal at Bulacan represented here by the yellow-green as well as the aqua-green lines, ay nakikita naman natin na tuloy-tuloy ang pagbaba. So, pero parang NCR na medyo bumabagal ang pagbaba. Subalit, para sa Cavite at Laguna, ito yung sinasabi namin na inconsistent. There will be dips such as this over the last week of May, and then it will go up and then down. So, hindi natin masabi na talagang tuloy-tuloy ang pagbaba or di kaya bigla siyang tataas. Kaya higit ang pagbabantays natin sa kanila. And on top of that, these 3 plus areas of Cavite, Laguna, and Rizal, we have seen na ang kanila pong mga ICU utilization rates ay yung nagsisiso from safe zone to as of June 30, naka-high to critical risk na po. Sa Laguna and Cavite at 74 to 78%, Rizal at almost 86% po. Isa sa mga huli ko pong pakita yung ating mortality curve, at ito yung gusto natin na higit pa nating mapababa. So, nakita natin na nag-peak tayo at 119 average deaths per day. We went down to 97 last May. We're now at 51 for June. Sa ngayon, we have reported already 720 deaths. We're halfway through the month. This is much less than the 3,000 na nire-report natin or na-report natin ng Mayo. But we want to push it down even more. Kasi kung titingnan natin ang ating mortality curve, para siyang step down, hindi tulad ng kaso natin na tuloy-tuloy ang pagbaba, tapos halos nag-plateau siya, bababa, medyo magpa-plateau, and then bababa ulit. So ito, kailangan nating, gusto nating bantayan at kino-correlate na natin to doon sa una, kailangan sapat ang ating mga kama, lalo na para sa ating ICU. Pero yung ikalawang kumbaga pagpapaalala ng departamento ay yung pagpapatingin po talaga ng maaga. Ang COVID nga po kasi nagsisimula siya pwedeng asymptomatic, posibleng very mild lang inyong signs and symptoms. But if you're elderly, if you have any comorbidity, it's very prudent na magpatingin agad so that you can be advised if you can stay in an isolation facility lamang or you would really need admission in a hospital po. So I'd like to end with these three things. And these are the recommendations we gave to the IATF. No? Nakikita natin ang affectation ngayon ng ating mga rehiyon, hindi lamang isang lugar sa rehiyon or isang probinsya, lalo na sa ating Mindanao areas. Kung hindi lahat, halos lahat ng mga probinsya or HUC doon ay nagkakaroon na ng pagtaas ng kaso. At nakikita natin,
kasi importante. Ano ba yung
nakikita natin napakahalaga na yung regional oversight talaga ng ating regional task force at regional IATF so that yung LGU may sarili silang interventions pero maganda yung it's well coordinated at the regional level so that if there are any similar issues or similar needs ng mga LGUs, these are things that the RTF can augment, no? At yun nga, gusto natin ding i-emphasize na oo, kinakailangan natin na kung tayo ay talagang overwhelmed ng ating healthcare capacity, the MECQ and ECQ are there to buy you time. No? Pero habang kaya pa at habang hindi pa naman lahat ng barangay or lugar sa inyong syudad or munisipyo ay apektado, gamitin natin ang granular lockdowns, no? Para mas targeted ang ating approach. Ikalawa, we've always been emphasizing the need to decrease this interval. No? I know we have mentioned a lot of reasons bakit hindi natin pa naaabot yung tina-target natin na sana ibaba natin until to less than 5 days from the time I get sick to the time I get isolated. Nakikita natin, napakahalaga talaga ngayon ng digital solutions and technologies. No? Tayo ay nagsimula na from a ladderized reporting system, ngayon po web-based tayo, pero nangangailangan ng mga digital innovations para mas mabilis mapapaalam sa mga kaso at sa mga close contact at sila ay maabisuhan na kinakailangan na nilang mag-isolate o di kaya mag-quarantine. Pero ito ay innovation na digital. Pero at the core, yung ikatlo na sinasabi natin, kailangan talaga ng sapat na tao para gumawa ng surveillance at of course, capacity to conduct testing. The last na gusto natin ipaabot ay yung patuloy na pag-augment ng Department of Health at ang kanyang mga partner agencies para nga magkaroon tayo ng mga sapat na ospital, kama sa ospital at tao sa ospital, and at the level of our LGU is a really good triage system and hopefully to mirror ang ating one COVID referral na center. So that's all. Thank you, Cholo. We'd be more than happy to take your questions.
Thank you po, Dr. Thea, for the updates on the COVID-19 situation. So we can see from the presentation that sa buong bansa, yung cases nga natin nagpapato na, pero we can't be complacent sa nangyayari ngayon sa bansa. So we still have to practice the minimum public health standards such as wearing of face mask, face shields, washing of hands, at pag-iwas sa mga taong lugar, at yung pag-ensure na may enough airflow kapag tayo ay nasa loob ng mga gusali. So magpabakuna rin tayo kapag when given the chance to protect our loved ones. Tapos, siguro, LGUs should also strengthen the implementation of our PDITR strategies. So for the open forum po, let's start with Caroline muna dahil siya yung sa chat. Caroline?
Okay. Good morning po, Ma'am Thea. Dr. Thea, tatanong ko lang po sana, based po sa analysis ng Department of Health, ano po yung possible reason bakit po tumataas yung cases sa Dumaguete? And sabi nga po kasi ng Okta, it's parang an area of concern. Also, ano po yung situation dun sa mga lugar na isinailalim ngayon sa MECQ? Bakit po sila, if may info po, bakit po nasuggest na mapunta sila sa MECQ? Thank you po.
Sige, thank you, Caroline. No? So siguro generally, I really have to get specific info on Dumaguete. But generally, the feedback of our regions is the increases in cases can be attributed to, well, two major things. One is they've really observed less adherence ng mga tao to our MPHS. And ikalawa is attendance to gatherings. Hindi ko alam talaga bang siguro we're feeling that yung nakukupi na tayo and people are very excited to go out, very excited to attend gatherings, whether it's social or it's work gatherings. And these gatherings, they become super spreading events in these areas. And I think dagdag ko na rin, napakahalaga yung pagbabantay, hindi lamang kasi ng LGU sa community, pero even in our workplaces. So we're seeing some increases in cases in our workplaces din. So those are the three major things that we need to, we have been receiving feedback on. The second yung tanong mo, bakit natin ine-escalate to MEC2, no? Yung ibang mga lugar natin. Ang metric ng pag-escalate ay iisa lamang. Kapag nakikita natin ang kanilang healthcare utilization ay umaabot na to a certain level. So for example, these areas, umabot na po sila to high risk and for some critical risk, no? Kaya nakita natin na kailangan na po nating i-escalate sila, no? Ang pag-escalate ay ginagawa natin para una, syempre i-control yung mobility ng lugar, pero yung ikalawang dahilan ba't natin ini-escalate, sabi nga natin, bumibili lang tayo ng oras para kung nangangailangan sila ng dagdag na hospital beds na tao, o di kaya kung kailangan na, ano ba yung dagdag na implementasyon ng PDIPR na kailangan gawin. Yun yung 2 linggo na gagawin nila yon at sana hopefully in the week after we'll already be seeing improvements in their cases as well as in their healthcare capacity.
Just one more follow-up question lang po. Ma'am, ano po specifically yung nakalatag ngayon na mga gagawin to help these areas? And like in terms of, kasi di ba ang main problems po is beds, healthcare, and kamusta rin po yung
Hello? Yeah. Go ahead, Caroline.
And kamusta rin po yung magiging deployment po ng vaccine doon? Thank you po.
Yeah. Yung ating, on the end of the Department of Health, we're there to number one, coordinate with our hospitals to see if they can already push their percent dedicated beds to what we call the surge capacity. That's 50% public, 30% private. If there's, in some regions, we have already augmented with deployment of nurses and other allied medical professionals. We have also augmented, no? Ngayon tayo ay bumibili ng mga dagdag na kama o di kaya mga dagdag na equipment so that they can convert their isolation beds or non-ICU beds to ICU beds. And of top of that, we're also in coordination with our partner agencies, no, mainly ang ating UCD, ang ating DILG. Kasi alam natin sa baba, kailangan din ng tao, hindi yung magbibigay ng clinical care, pero yung maghahanap ng mga kaso, magko-contact trace at mag-i-ensure na they are properly isolated or quarantined.
Sorry, wala na po akong, clarify ko lang po. Kasi I saw someone from Cagayan Valley Medical Center. Kasama rin po siya sa Q&A today.
I am unsure. Go ahead, Jolo. Habang hinahanap ni Jolo to answer the vaccine, yes, no, actually part din ng strategy natin yan. The secretary, no, has committed that we will review our high-risk areas, no, so that we can see the augmentation we can give. But I guess we need to level off that right now. Padating pa lang ang ating mga bakuna. So as soon as the vaccines arrive, we'll be able to augment, no, especially ngayong itong mga high to critical risk areas na. Sorry, Jola, go ahead.
Our CHDs are only audience today po.
Okay.
Thank you.
Okay, for the next question, Kat Domingo. Kat.
Good morning, ma'am.
Morning.
Ma'am, pa-clarify lang what you said just a while ago. The secretary has committed that we will review our high-risk areas. Meaning po ba nito, mababago yung percentage of distribution, like ma-adjust yung 40% Luzon, 60% other areas?
Ito yung tuloy, sa tingin ko isa to sa mga nire-raise na concern sa amin, no, yung pamimigay ng bakuna. And ang term nga ng ating NPOC is yung mga proportions na binibigay natin, these are not parang written in stone. Kung tulad nito, nakakakita nga tayo ng pagdami ng kaso sa ilang lugar ng ating bansa, we need to reallocate. But of course, gusto ko lang i-level off na we are working with a very limited supply, no? And we cannot focus kasi, of course, all of our vaccines in 1 or 2 or 3 areas. So it's always a balancing act of number one, being able to equitably, no, provide vaccines to all areas in the Philippines, but at the same time, augment a bit in areas na meron na tayo nakikita pagtaas ng mga kaso.
Doc, what will be the barometer for the DOH to start adjusting the supply kung per province or per region?
Siguro, kahit hindi ko siya masagot, what I can say is that yung specific barometer, I cannot answer. No? I will refer that to EDVOC no, pinayos sa kabotahe. Pero yung nabanggit ko, one barometer will really be, eto, sino ba yung mga areas na meron tayong case file? Pero kung ano yung dagdag o porsyento na ilalagak natin, baka po best na masagot ng EDVOC natin. We'll get back to you on that.
Ma'am, one more question from me po. Sabi niyo po kanina, Calabarzon is parang hindi na top ngayon ng NCR, it's actually Calabarzon. Can we say that the epicenter has shifted to Calabarzon? I know DOH has been quite technical with using the term epicenter. Paano po ba dapat, given na hindi na yung NCR yung top contributor?
Sige. Kaya kanina, when I was showing the line graph, I was trying to emphasize na pag meron kasi tayong parang terminology or description to an area, it seems that ito yung high priority, ito yung sabi nyo nga epicenter. Pero tama kayo, very technical kasi yung term ng epicenter. We would really like to avoid kasi it means like siya yung gitna, siya yung pinanggalingan. Ang point din is paano yung nasa gilid, no? What kind of priority are we giving to the periphery of that epicenter? So while yes, we're seeing a plateau and even an initial rise in Calabarzon, making that one of our priority areas. NCR in itself is still a priority, not just because of the case data, pero una is the largest region. No? We've seen how NCR drove our numbers at the start of the pandemic and even in the second peak. Pero kaya siya nagiging equally important is, ano din siya ang term talaga namin is fragile. It can go either way. The next few weeks will tell us kung yung plateau na nakikita or yung very slow decline na makikita natin will really become a continuous decline or pwede siyang tumaas. No? So napakahalaga ng pagbabantay sa LGU, sa workplaces, and tayo even as members of this community.
Okay, so reminder, gentle.
Ma'am, sorry. Last na po, clarification lang. Ma'am, sorry, ang iix yung kapitbahay namin. Ma'am, when can we say na de-escalate na yung yung NCR from being the epicenter? Because my concern lang po kasi is the DOH has stopped using the term epicenter for other areas. Kaya lang, it might give the impression na parang hindi na nawala yung NCR sa pagiging epicenter even if cases have been significantly declining.
I don't think, well, for me, we've never, sige, ganito, hindi natin tinatanggal ang focus sa NCR. Actually, ang sinasabi natin, maganda yung naging performance ng NCR, pero patuloy yung pagbabantay nga sa kanya. No? Ayaw naming matanggal yung focus or yung parang ayaw naming malikmata kay NCR. Gusto natin lahat talaga ngayon. And I think that what's make it even more challenging at the national and regional levels, wala tayong region ngayon na hindi kinakailangan bantayan. Ito yung panahon na talagang closely monitoring each and every area so that we'll see kung ano yung trend. Kung plateau siya, higit na babantayan kasi gusto ko makita kung baka bigla siya mag-uptick. O kung siya nga ay unti-unting tumataas, gusto kong bantayan kung yung pagtaas na yun ay tutuloy-tuloy na or di kaya ay susundan siya ng pagbaba ng kaso. I hope, Kat, na clarify ko yun.
Okay, thank you po.
Thank you.
Gentle reminder sa media, please ask questions related to Dr. Thea lang po. So for the next question, Aiko.
Yes po, good morning, Dr. Thea.
Morning,
Dr. Thea, what are the main factors that help NCR plus areas have a decline in cases po? Nakikita po ba natin na although with the strict adherence po sa minimum public health standards and the community quarantine, but do we also see po yung pagtaas ng vaccine confidence ng mga tao para po makatulong sa decline ng cases?
If you remember yung formula namin on the RT, no? I think for NCR, what really helped na bumaba siya, it has a very strong regional quote-and-unquote task force. That's one. We have MMDA really pulling together our LGUs, our NCR mayors, and it's moving as one, yung NCR, and that really helped. And that led to improvements in their PDITR, that led improvements to enforcement of our MPHS. And of course, the vaccines did help too, no? Kasi nakita naman natin, kasama siya doon sa ating BIDA. It's a BIDA solution plus natin, yung bakuna. Pero again, no, ayokong mawala tayo sa focus na bakuna lang to. Mahalaga yung bakuna, pero kasabay dapat nun ay ang matatag, no, very strong na PDITR implementation, as well as yon yung ating MPHS compliance.
And another one po, Doc, you've mentioned po that super spreader events can affect again surge sa COVID-19 case, especially in NCR+. They may have an uptick again and prominent rise po. So aside from gatherings po, Doc, nakikita po ba natin ang threat din sa vaccination sites to have super spreader events, and what are our recommendations? Will we recommend other restrictions po so that this can be avoided? Thank you po, Dr.
Sa tingin ko, since the start of our vaccine deployment, what we've emphasized for our vaccination sites is the need to ensure, no, na ang ating mga pupunta doon, yung mga nag-hold or nagagawa ng vaccination, will follow our MPHS protocols, no? Kaya halimbawa ngayon, may ongoing vaccination sa Department of Health. Hindi lahat sabay-sabay, no? Hindi kaya properly spaced out ang mga tao. Everyone will have to wear a mask and a face shield. At yun din ang paalala natin, no, pag tayo nagbibigay ng advisory na bago tayo pumunta, no, sa mga vaccination site, parang meron tayong gear, di ba? O may mask ako, may face shield ako, meron akong alcohol to disinfect. And when I get there, I need to practice physical distancing. Hindi to panahon na tayo ay magchika-chikahan sa line kasi noon mo lang muna nakita ulit mga kaibigan natin. So we can be there and we can get vaccinated safely if we only follow the MPHS protocols.
Thank you po. Thank you, Dr.
So for the next question, Bonds.
Hi, Dr. Bonds from Rappler. So yeah, for my first question, of course, we've been noticing that cases in NCR have been declining like for the past days. Meron na po bang analysis yung DOH kung ano yung nagpapababa ng kaso natin sa NCR aside from, of course, minimum health standards? And has it something to do with the rate of vaccination here in the capital region? And for a follow-up, what best practices can other provinces learn from the capital region given that, of course, bumababa nga yung kaso natin?
Yeah, I think I answered kay Aiko nga na, of course, our vaccines are helping. But alam nyo, at the core of it, what I think is really helping, no, bago naman tayo magkaroon ng mas maraming deployment ng bakuna sa ating NCR and the plus areas, andun kasi yung pagpapa-strengthen natin ng ating PDITR and MPH. So, with or without the vaccines, we have seen the decline. And with the addition of the vaccines, nakita natin yung further decline in the NCR plus, no? We'll reach a point that we'll have already a specific coverage of NCR plus and even NCR in itself. Pero kailangan maiwan kasi talaga tong PDITR natin. That will ensure that cases are being found quickly, isolated quickly. And di ba sinasabi nga natin, even if you have been fully vaccinated, you still need to follow the MPHS protocols, no? Mahalaga yon as a additional prevention to limit the spread ng itong ating COVID-19 infection.
Okay po, Doc. Doc, next question. Okay, you mentioned about plateauing kanina. So para lang din clear sa mga report, paano po ba masasabi na ang isang lugar ay nagpa-plateau na yung cases in the layman's term? Thanks.
Okay, sabihin ng plateau flat, no? Parang pag meron tayong tinitingnan natin yung pagre-report ng kaso, parang itong linggo na to, kung hindi halos kasing dami, no, yung nire-report na kaso nitong linggo, katulad ng mga nakaraang linggo. Yun ang sinasabi natin na nagpa-plateau. No? Medyo, pag tinignan nyo kasi minsan ng ating epidemic curve, lalo na kung ipa-plot nyo siya sa araw-araw, di ba parang ang daming siso. Pero yun, pag nag-smoothen out tayo, tapos it looks like a almost flat na line. That's what we call a plateau.
Okay, just a follow-up. Hindi naman ito necessary like a super good thing, right? Kasi like for example, if nag-plateau nga tayo pero nasa 6,000 naman. So how long na tayo naka 6,000 compared na bumababa talaga siya, right? Tama po ba?
Tama ka, Bonds, no? So kasi minsan madalas tinitingnan natin numero lang, no? Tayo, ang tinitingnan natin, una yung numero, madami pa ba tayong kaso or kaunti na? Ikalawa, posible ngang madami pero mas kaunti na ba to kumpara sa sumunod na linggo? Yun yung trend na sinasabi natin, no? At ikatlo, pwede ngang madami pero pwede ngang kaunti ang mga kaso natin. Pero kung maliit din kasi yung population natin, posibleng ang taas ng tinatawag nating attack rate, no? Or yung affected na population. Kaya tinitingnan natin yung ating agar. So, ito yung tatlong major case metrics na tinitingnan natin so that when we assess the situation, we can say na, okay, this area is doing well, or this area needs a bit more improvement, or this area parang yun nga, no, it's staying in the same situation. What can we do to push it na mag-improve pa further yung kanyang situation?
Okay, thank you, Doc.
You're welcome, Boss.
Limit na lang po natin to 2 questions per media. So next question po, Red.
Hi, good morning, Dr. Ya. You hear me?
Morning,
Narinig
Red.
mo ko?
Yes,
Okay.
go ahead.
First question, deaths. We are now in the nearing 23,000 level. Is this a cause of concern for the DOH na we are experiencing more than 100 deaths per day? Is this a cause for concern po?
Sa tingin ko, any death should be a cause for concern, no? Na lalo na nakakita tayo, nag-peak pa tayo ng 119 deaths, no, per day last April. Pero ang nakikita naman natin, bumababa ang ating deaths per day. But of course, we want to push it down. Kaya na sinasabi ko kanina, bumababa siya, pero we're not seeing as swift a decline as we want, no? And we want to push it even further. And if you remember, some reporters asking, I don't know if it's last week or previous week, I want to emphasize 2 things, no? Yung ginagawa natin para mapababa pa natin yung mga deaths natin. Una ay ang tuloy-tuloy na pagdagdag ng ating hospital beds, lalo na yung ating ICU beds at mga tao at equipment na kailangan para sa ating ICU beds. At ikalawa, yung panawagan talaga, the need for people to seek consult early, especially the vulnerable, yung matatanda at may mga comorbidities. So that, alam mo yon, you know agad, kailangan mo bang ma-hospital or pwede nga sa isolation facility ka lamang at dun pa muna bantayan.
Okay. Second question. Of course, we all know naman that NCR naman always has this improved response lagi with, of course, coordination with the MMDA. And I know the local government officials are trying their very best naman in other provinces. Pero is this enough? Kasi parang nakikita ko parang hanggang ngayon, nagki-claim pa rin yung mga LGUs na they still need national government help, kulang kami sa ganito, ganyan. I mean, hanggang ngayon pa rin, the increase in the cases, parang hanggang ngayon pa rin, ang gusto pa rin nilang humingi ng tulong pa rin sa national government instead na i-improve nila yung system nila of tracing, testing, and isolation, which we all know yun ang gusto nating gawin. So, paano natin ito mare-reconcile doon sa concern ng mga LGUs na hanggang ngayon, we're doing well naman on testing, tracing, pero hanggang ngayon, tumataas pa rin yung kaso namin. So, hindi namin alam kung saan nanggagaling yung issue. And yun nga, one of the concerns nga is yung loosened up restrictions, border restrictions, RT-PCR, and also how can we reconcile all these issues regarding sa response ng mga ibang local government, especially in the provinces?
Yeah. Siguro kung i-context ko siya rin, ang ating response naman, we have this perspective na it is LGU-led but aligned to our national protocols. I think the role of and it boils down to accountability. You're right, no? Ang LGUs natin, meron silang accountability to ensure that PDITR, all of these strategies are well implemented. But I think that's why we're emphasizing now the regional and national accountability then, because ang role ng region at ang national ay una, tingnan kamusta ba yung ating LGU at kung meron tayong LGU na nangangailangan ng further assistance, kung hindi man to through resources, it can be through technical assistance. That's the role of the regional and national government. Of course, we want them to be autonomous. We want them to be able to lead already. Pero it's a full of government response. And if we see LGUs needing augmentation, we're there so that yun nga, eventually, if there will be future spikes in their areas, kakayanin na nila, no, with minimal augmentation and or assistance from regional and national offices.
Okay po. Salamat po, Dr. Salamat, Jolo.
You're welcome.
So next question, Lay.
Good morning, Doc Thea.
Morning.
Doc, you mentioned na yung vaccination, nakikita nyo na isa sa mga nakapag-contribute sa pagbaba ng cases sa NCR. May data na po ba that would support this?
Yan, magandang tanong yan, Clay, no? Hindi pa kita masagot ngayon, pero yan ang pinag-aaralan natin. No? So we have partners such as Pasteur, such as Autumn, who is helping us see, no, kung ano ba yung naging epekto nitong mga pagpapakuna natin, no? Depende sa coverage na on certain areas, how much has it led to decline in cases? Siguro we're still building that model, no? Pinag-aaralan yung tinatawag naming assumptions. Sorry, medyo technical. So yung mga assumptions so that when we do relay and we're able to better quantify or see the impact of the vaccines, confident tayo doon sa datos, no, na ipapaabot natin to media and to our public. Suffice it to say that right now, the BIDA solution, the MPHS, the safety protocols, the PDIDR plus vaccination, let's work on this, no, para tuloy-tuloy na talaga yung pagbaba ng mga kaso natin.
Pero Doc, pending that study, offhand, ano po yung paano po natin nasabi na nag-contribute po yung vaccination? Like ano po yung nakikita po natin sa trend ng cases sa NCR nung nung start and nung bumibilis na yung vaccination sa NCR?
I think if you want me to point out like when tayo nakakita na nung nag-vaccinate, tuloy-tuloy, no, or mas lalo bang bumilis yung pagbaba ng kaso. Yan, parte yun ng pinag-aaralan natin. But I think the fact that the effect naman of our vaccines, the effect is really protecting, no, us from getting ill, especially the severe and critical illnesses, is one reason why we're saying that, you know, the vaccines are helping, no? But for me to truly quantify na, again, if there's 100%, ilang porsyento doon ay dahil sa bakuna. Yan yung gusto nating pag-aralan. Pero nakikita natin yun, yung sa 100% na yun, mahalaga lahat in place, no? Na yun nabanggit ko kanina. And the vaccine will play a role as something that will protect me from getting ill. And hopefully for some vaccines also prevent me, no, from being able to transmit that infection to other people.
Doc Thea, meron po ba tayong data so far yung vaccination coverage sa NCR?
Meron naman, pero sorry, yan ang ibabalik kong tanong kina Cholo. The more updated vaccine stats, I'll have to get back to you on that, especially if it's per priority group natin sa NCR. Apologies.
Thank you, Doc Thea. Doc, yung sa pinapatanong lang po ng aming news desk, yung ano po yung basis bakit daw ginawang MECQ yung Lucena at Dinagat, and then yung South Cotabato naman ginawang GCQ, pero last week lang daw nagkukulang yung beds at equipment doon.
Okay. The basis for escalating an LGU is on the healthcare utilization rate natin. So nung tinitingnan natin ang mga healthcare utilization rate ng iba't ibang lugar na to, nakita natin, no, for Lucena, Dinagat Island, liban doon sa nakikita natin na tuloy-tuloy na pagdami ng kaso, umaabot na po to high risk, no, in even their ICU, minsan nag-high to critical risk na. In comparison, ang South Cotabato, nung sinisilip natin ang kanilang datos, oo, may nakikita din tayong pagtaas ng kaso. Subalit ang kanilang healthcare utilization ay naiiwan lamang, no, sa moderate risk. At ganun din, no, even their ICU, hindi natin nakita na umabot ng high to critical risk. Yun ang dahilan, kaya si South Cotabato ay nilagay na natin kay GCQ, habang ang Dinagat, Lucena at yung ilan pang mga additional na lugar ay nilagay naman natin sa MCQ.
Jolo, pwede bang isang question, one last?
Sige po, go.
Yung sa Dumaguete, Doc Thea, may detected cases din po ba doon ng variants?
Wala ako sa pagkakaalam na variant of concern in Dumaguete. No? Wala tayong nakukuhang ganung datos. No? Ang buong Region 7 actually, wala tayong na-detect na variant of concern sa ngayon. Ang nakita natin sa buong Region 7 ay yung tinatawag na nating P.3 variant, which is not a variant of concern.
Thank you po.
Sure.
Okay, remind ko lang po yung media na for any bakuna-related question, you can send them sa Viber group chat namin and we'll refer them to NVOC so they can answer. So next question is Greg.
Hi, sorry Sir Jolo. This question is quite related to vaccine, pero in relation to trends of COVID-19. So I'd like to ask Dr. Thea, aside from NCR po, are there other areas showing parang improvement in their COVID-19 cases which we can attribute to vaccine deployment? I'd like to further lang kasi yung reason why we are adding allocation to certain areas where we are seeing higher number of cases.
Sa ngayon, ang ating namang karamihan ng ating mga naibigay na bakuna is really in the NCR plus areas. Siya yung biggest, no? But I think gusto ko lang i-emphasize na ang rason din kung bakit madami din tayo nila binigay na bakuna sa NCR plus areas in terms of proportion, no? Yung population ng mga rehiyon na to, malaki naman din talaga. No? So that's number one, to clarify that. Secondly, kung ano ba yung nakita nating epekto, I think much like the effect of the vaccines in the NCR, nakakita din naman tayo sa plus area. So balit again, babalik ko yung sagot na hindi pa namin ma-quantify sa ngayon. Ito yung pinag-aaralan, no, ng ating partners, ng ating mga naggagawa ng disease estimates para makita natin what's the impact of these vaccines. But the reason why we want to increase allocation in our high-risk areas is number one, gusto natin, remember, sino ba yung pinaprioritize sa bakuna? These are the health workers. We want them to be immediately vaccinated because we don't want an overwhelmed health system to be further overwhelmed by additional healthcare workers getting sick. Gusto natin meron tayong sapat na healthcare workers. And second, we want to fast-track vaccination of A2 and A3 because these are the most vulnerable. These will be the people most likely to become severe critical and fatalities, no? And we want na kung magkaroon man ng uptick in cases, we prevent this vulnerable population to become these fatalities at sila yung masama natin sa ating nire-report every day. So, and these are the people who will be using our hospitals. No? So we don't want to push them to become severe and critical, further overwhelming ang ating health system capacity. So that's the reason for additional vaccines in this area.
Thank you po, Dr. Thank you,
You're
Jolo.
welcome.
Okay, for the next question, Rafael Bosano.
Hi, Doc.
Hi, Rafael.
Since nabanggit naman po before na yung loosened restrictions may have contributed to the plateauing of cases, ngayon po na yung NCR and Bulacan is at GCQ with some restrictions, tapos yung other areas GCQ with heightened restrictions, may worry po ba tayo na magtutuloy-tuloy ang pagplateau at matatagalan pa bago bumaba significantly yung cases to pre-surge levels?
When we talk about parang it's like, sige, mag-loosen ako, tapos tataas naman ang kaso. I think the approach that we want to take is, we can't stay in this very high community quarantines. That's why we want to move towards lower CP levels. But it's with the mensahe na kahit na tayo ay nag-loosen, kailangan in place itong mga safety protocols natin, itong safeguards natin. Kaya bago natin binawasan yung mga restrictions sa NCR, sa ating Bulacan, tinignan natin kamusta yung datos nila sa kaso, tsaka healthcare utilization. Nakita natin, though pababa at medyo plateau nga yung kaso sa ibang areas, ang kanilang healthcare utilization ay nasa safe zone na . At yung ikatlo na mahalaga natin pinapaabot sa mga lugar na to, they did well. No? Meron na tayong magandang nagawa. Meron silang effective na response, no, to the uptick. So they need to continually implementing those para nga hindi tayo bumalik uli, no, to higher community quarantines or even on overwhelmed hospital or healthcare capacity once again.
Okay po. Kayo po ba, ma'am, sa EB, may nagawa po ba kayong modeling or projections as to when we can return to pre-surge levels? Kasi po may ibang mga analysts na sinasabi, if we continue at this rate, baka abutin pa po ng 2 months bago tayo bumalik sa 500 to 600 cases per day.
Yeah, we've done some models, pero ito yung nabanggit ko kanina na we want to revise the models because in those initial models by FASTER, hindi pa kasi nakatake into account dun yung bakuna. So, hindi lang namin na-share ngayon, pero we have partners that we want to take into account kasi lumalaki naman na yung coverage natin. So, we're still reviewing those models. Once we have them ready and vetted, we'll be more than happy to share, no, kung ano ba yung future, no? Pero gusto ko lang mag-caveat, no? Again, parang yung sinasabi nga ng nag-share ng information, these are just estimates. And oftentimes, it depends on kung anong nangyayari ngayon, di ba sabi nga, kung ito gagawin natin dire-diretso, ano kaya yung mukha natin 2 linggo, 1 buwan into the future. Kaya lang, I think one of the challenges in estimates is we're changing some things every week or every other week. So we want to be more fit, more accurate, so that if we do estimate that we'll reach this pre-surge level in 2 months, we'll be able to confidently relate to you na yun yung nakikita natin sa ating models.
Thank you, Dr. Thea.
You're welcome.
Okay, that's all the time we have for our open forum. Dr. Thea, may final message sa viewers natin.
I think I'm always saying the same things, but I will not tire of saying the same things. No, of the 3 accountabilities. Unahin ko tayo as government, of course, and trabaho natin ay to ensure, no, that these strategies are in place, that we are finding cases and close contacts immediately and as swiftly isolating and quarantining them. No? The second accountability are our workplaces and our establishments. That's why we're having these safety seals. Let's have these safety protocols in place. No? And the third is tayo, always the individual na ambag natin. No? Nakakapagod ang pagmamask, ang pag-face shield, ang pag-physical distancing. I haven't hugged my mother for a year. But you know, these are all sacrifices we want to make because gusto nating bumalik tayo not just to a new, but to an even better norm. So yun lamang po. Salamat at magandang umaga po sa lahat.
Thank you everyone for joining us in this Kapihan, Dr. Thea, and everyone. So that's it for today. Thank you.
Salamat. Ingat